Welcome, and thank you for joining us for episode 3 of Let the Adventure Begin. Today is all about nutrition and eating for pregnancy with OBGYN Dr. Lindsay Davis. She is coming to us live from the Center for Women's and Children's Health on our Newark campus. Dr. Davis, thank you so much for being here today.
Thank you, Megan, for having me today. Glad to be here.
Absolutely, and just a reminder to our viewers, I know this can be a topic with an endless number of questions. So if you have any questions on nutrition that you'd like to ask Dr. Davis, please leave those questions in the comments below this video, and we will get to them throughout this conversation. Now, Dr. Davis, let's start big picture. Why is it important that we're even having this conversation about nutrition and pregnancy?
Absolutely. One of the most important things that we can do for our own health and for a developing baby's health is paying attention to what foods we're putting into our body. Having a good, healthy, well-rounded diet is great at helping to prevent certain diseases like hypertension in pregnancy and can help to minimize the risk of things like gestational diabetes in pregnancy. There's also certain elements within our diet that we need to sufficiently grow a baby. Things like folic acid help to develop both the brain and the spinal cord. Those are things that develop early on and things that we want to make sure that we're getting adequate folic acid intake as early as possible, even prior to pregnancy. Things like iron help to minimize risk of anemia in pregnancy. And then having adequate calcium to grow baby's bones and omega-3s to help grow baby's brain are all important aspects of diet.
Absolutely. So let's start in that first trimester. Some women get so sick that they're living off of bagels or whatever it is that they can keep down. Talk about how to stay not only healthy during that time period, but also, what foods maybe should you be trying during that time?
Absolutely. So majority of women are going to experience some degree of nausea in pregnancy. And that's most oftentimes confined to the first trimester. So we feel tired, we feel nauseous, we don't want to cook the foods, we usually like to maybe eat, and our body is craving a lot of those simple carbohydrates. What I say is being able to break up small meals throughout the day, try to get 5 to 6 small meals or snacks will help us to feel better and more energized. That helps our blood sugar levels to stay more even throughout the day and can help to mitigate things like nausea. Adding something like ginger candies or ginger tea, peppermint candies, tea, or cooking with peppermint can help as well. And then a lot of times with nausea, we feel better with cooler foods. So sometimes sneaking in some frozen vegetables with some fruits into smoothies, a great way to help to have a little bit more of those essential nutrients and maybe avoiding as much of the bad foods.
So let's talk a little bit about the bad foods. The sushi, lunch meat, name your do not eat list of things that you may find on the internet or from talking to other friends. Let's go through some of those foods and talk about what to avoid or how to healthily eat some of these items.
Absolutely, Megan. I will say there's to some degree a longer list that we'll go through in our Eating Well for Pregnancy series, but things that you mentioned, sushi, the big concern is eating raw or undercooked meats and fish can make pregnant women sick, which is not good for our body and that's not good for baby. When we're pregnant, our immune system is not able to fight diseases as readily as it does outside of pregnancy. So we're more susceptible to food-borne illness. That's why we want to make sure any meats or fish that we're consuming are all thoroughly cooked and that we're taking care to adequately wash things, even like fruits and vegetables that can also cause some food-borne illness. You had mentioned soft cheeses. One of the big concerns with soft cheese is that sometimes with that process of making it, it might not go through the pasteurization process that kills a lot of the bacteria we would be concerned with. So women can have soft cheese if it is pasteurized. So it's very important to make sure that we're checking the labels before consuming some of those cheeses. Then things like deli meats and hot dogs, those are refrigerated. But one of our concerns is that there's certain type of bacteria called listeriosis, which can cause severe illness in pregnant moms and can also even lead to things like stillbirth and pregnancy. That's why we recommend avoiding eating those foods unless they've been warmed up to a steaming hot temperature. And in that case, it's sufficient to kill that concerning bacteria and would be safe to consume.
So hot dogs, for example, if you were putting them on the grill, would probably be okay.
You want to cut that hot dog open, make sure that it's cooked and warm all the way through. And in that case, yes, then that would be okay to consume.
So another big topic, I know one that I asked when I first became pregnant, was caffeine. What is okay for caffeine and where should you stop?
Absolutely. So a small amount of caffeine, and some people might even consider it a moderate amount, is safe. So that technically we would say up to 200 milligrams of caffeine daily is going to be safe in pregnancy. That is equivalent to a 12-ounce cup of coffee. So again, just checking our labels. We do not want our pregnant moms going out and consuming energy drinks. That's going to have way more caffeine than we should be having. Our concern with caffeine is that it can raise our blood pressure, it can raise our heart rate, and we're already susceptible to having an elevated heart rate in pregnancy. And it can cause a constriction of our blood vessels so that we're not getting as much blood flow to our developing baby.
I know I can share many of the apps for some of the coffee shops. Dunkin' and Starbucks list the caffeine in the app when you order. So if you're looking to check that, that is my hot tip of the day for all of the other expecting moms out there for sure. So we do, speaking of our other expecting moms, we do have a question. Question came in from Deborah. She asks, Dr. Davis, how much weight should one gain when they're pregnant, especially if you are plus size?
So Deborah, that's going to vary based on what our starting body mass index is. So I would recommend that every pregnant mom should be discussing that with their provider. Somebody who's starting off at an average BMI is going to be a 25 to 35 pound weight gain for a healthy pregnancy. That's going to be less depending on what our starting weight is. Essential weight gain in pregnancy for baby developing, the placenta, the amniotic fluid, that's usually about 10 to 12 pounds that we're inherently gaining of just a developing baby itself. But I would just encourage you, rather than going through each of those individual points, to talk with your individual provider.
Deborah, thank you so much for that question. And if anyone else has questions, please continue to submit them in the comments. And I think this is a really good time to bring up eating for two. That is the go-to thing that you hear everyone say, but that's not necessarily how you should be eating.
Exactly. So yes, pregnant moms need more calories than a non-pregnant woman for sure. That, we feel hungrier. We want to be able to make sure that we're getting good nutrients to baby. But on average, it's only 300 additional calories daily that pregnant moms need to get adequate nutrients to kiddo. And that's equivalent to 1 cup of cereal with a cup of milk. So adding little snacks throughout the day is great, but just looking at that overall, consumption, it doesn't need to be doubling our caloric intake.
So let's go to the third trimester where you have the glucose test and you're thinking about gestational diabetes. How can we manage that throughout all of pregnancy so you're not really just worrying about, oh no, I'm 28 weeks. Have I been properly taking care of myself?
Absolutely. So why we recommend that all pregnant moms should be screened for gestational diabetes by the third trimester. And we do that screening test between 24 to 28 weeks. That entails having a glucose low, drinking this very sugary drink, and an hour later we'll check to see what the blood glucose level is. Now we test all moms because we know that as the placenta is developing, it is releasing hormones that can make it more difficult for any pregnant woman to process her blood sugars. That's supposed to aid in helping to develop baby, and so that baby gets that good glucose. But sometimes there can be overcompensation and lead to a disease state. So no matter who you are, everybody should be screened for gestational diabetes. What we can do to help to just have healthy pregnancy and helping to minimize risk of things like diabetes would be eating good, well-rounded meals, lots of good vegetables, complex carbohydrates, and lean proteins are going to help to maintain a more steady state of our glucose levels so that it's not causing large spikes in those glucose levels.
Those are definitely great tips. Thank you. And it's not just nutrition that pregnant women should be thinking about. How else can we make sure that we're staying safe during this such an important time?
Absolutely. Thanks for asking, Megan. One of the most important things our pregnant moms can be doing right now while we are still very much in the midst of the COVID pandemic is get vaccinated. I know a lot of pregnant moms who might be apprehensive about the COVID vaccine, but there is plenty of literature and data and evidence at this point in time to support vaccination and pregnancy. All of our major organizations, the American College of Obstetrics and Gynecologists, the Society for Maternal Fetal Medicine, recommend that pregnant moms do become vaccinated. The Pfizer vaccine has been FDA approved at this point in time. And we would recommend that if you have not become vaccinated to do so, because unfortunately we are seeing a rise in pregnant moms being hospitalized with COVID. It's one of those things that if the disease is contracted, pregnant moms can be up to 3 times more likely to require intensive care services. And that can be detrimental to both moms and to babies. So if you have any further questions about COVID vaccines and pregnancy, please talk to your obstetrical providers.
Thank you for sharing that. And we do have a question that came in about boosters. Should those pregnant people who have gotten vaccinated get a booster? And I know, so many of those booster questions are still up in the air.
Right. So great question. At this point in time, there have not been profuse, recommendations for having the booster vaccine yet. We are awaiting recommendations from those societies I had mentioned, from the CDC and from the FDA. So at this point in time, we are not recommending for or against.
And just the general precautionary measures for COVID, continue to wear a mask, continue to wash your hands. What do you recommend to your patients who have a wedding this weekend or, have things that are trying to live in this COVID world right now?
Yeah, I think that we all still need to stay vigilant, to be honest. I mean, we're seeing the rise of Delta. We are seeing a lot more infections in our pregnant moms. And so maintaining social distancing, certainly good hand washing, wearing our masks, but to be honest, a vaccine is going to be our most efficient way of being able to protect against the virus. I would say I would not recommend large gatherings at this point in time. But I think that if there are questions of travel and gatherings and who's going to visit with baby, those are great conversations to have with your provider.
Absolutely. And I'm sure questions that many of our viewers have. So Dr. Davis, so much of what we talked about today can be heard again at your Eating for Pregnancy series, and there's so much more information we didn't even cover yet today. So talk about that upcoming class in October and what viewers could expect for those.
Absolutely. We are so excited for this series. So we have an entire Eating Well in Women's Health series. And under that umbrella, there's an understanding and eating well for pregnancy. And that goes through all of the things of what nutrients do we need, what's the breakdown between fruits, vegetables, our carbohydrate servings that we should ideally be getting. How can we have that healthy weight gain for where we're starting? We have a collaboration with our nutrition department, helps to present that series. And we've also partnered with a culinary medicine program, the Vetri community program out of Philadelphia. Will lead a cooking demonstration at the end of that program. And then they have a whole cook along series that they will be doing separately. So all of those dates will be on our website, and everything is virtual, so easy to be able to join in, and we'd love to have everybody join us there.
Absolutely, and if you're interested in those classes, you can find the links in the comments below this video. So Dr. Davis, tell me a little bit about your practice before I let you go and how someone could join your practice or learn more.
Great. So I'm a provider. I'm a general OBGYN at Christiana Cares, Greenville Obstetrics and Gynecology. We're made up of 7 physicians and a midwife, in addition to our mid-level providers. We have 3 different office locations between Delaware and Pennsylvania. And I believe we'll be sharing the number to call to schedule an appointment, our address, but you can also find us on the Christiana Care website when you look up Christiana Care, Greenville Obstetrics and Gynecologists.
Absolutely, and those links are in the comments below. So if you'd like to be a patient at any of those 3 practice locations, please click those links below. Dr. Davis, thank you so much for your time. And I know you've answered so many great questions today, and we look forward to speaking with you again soon.
Okay, great. Thank you so much, Megan.